Okay, and welcome again, everyone. And I will start this by asking each of our panel members to introduce themselves, the organization they work for, and their area of expertise.
Hello, everybody. I'm Wendy Miller. Some of you may know me from my time with Caregiver Connections, and I lived up here for almost 15 years. Recently moved down to Loveland, but I have my own business called Family Caregiving Solutions, and I work with families and older adults who are trying to figure out what's next, coming up with a plan, getting family members to all buy into a plan ideally, and helping them execute that so that ideally they can age in place. That is more of my specialty, aging in place.
Hi, I'm Jenn Gomer with Care Patrol. I grew up here, and that's why Care Patrol of Denver showed up in Eagle County. I miss everybody. So my background, I was an ER ICU nurse, then I was a case manager, and they had a situation at the hospital where people were getting readmitted and the hospital wasn't getting paid for it, and it was my job to look into it. And I got really upset because a lot of these people were getting readmitted and it wasn't their fault. It just was the kind of situation they're in. They weren't having the support they needed. Care Patrol came and did a presentation and said for free, we get to meet with clients, go over their situation, help figure out if home care, assisted living, memory care, skilled nursing, all those options, what's the best for them. And after the presentation, I walked up to the lady and I was like, if I work for you, can I work from home? And she said, are you asking for a job? I said, yes. So I quit at the hospital, started working for Care Patrol, and then 2 years later, I bought the business. So I have a passion for seniors, and I love helping families navigate what can be a very challenging time.
Hi, I'm Shelley Cornish. I'm the Executive Director for Castle Peak Senior Life and Rehab here in the Valley in Eagle. I've been there for about 6.5 years. Our building opened up from the community support. We opened up in 2016. And really what we do is we're a skilled nursing facility, rehab facility, memory care, and assisted living. So we kind of have a lot of options within our building. I've been in senior care since I became a CNA when I was 15, so a long time. I've never left the business. I love it, and that is my passion, so thank you.
Okay, thank you. We'll go ahead and start the panel discussion. We'll start with the kind of the entry level, which would be Wendy, aging in place. So,
Thanks. I forgot to mention that my mother lived with me for 8.5 years, and I managed her care in the home. And at least there's one of the caregivers that is here today that took care of her. It's nice to see you. She lived to almost 102, so I used to joke that I'm doing too good of a job.
so Wendy, when should a family caregiver consider hiring outside help?
So I like to say that if you've thought about it, that maybe I need some help, then you probably need some help. I think you really need to be honest with yourself and listen to your gut. Try not to listen too much to the head. Family caregivers are notorious for wanting to take everything on themselves because they believe it's their duty. And the idea of bringing somebody in makes them feel really guilty. And I often hear things like, well, but my husband, my wife, my mom, my dad, they don't want somebody else coming in and taking care of them. They just want me. And I say, tough.
Yeah.
You have the right, family caregivers have the right to this quality of life as much as your loved ones.
So, Wendy, how do you find the care you may need when aging in place?
Oh boy, I had so much more to say.
Oh, I'm sorry.
Because I know we're trying to keep it, but I honestly did time myself,
Okay,
so I won't
okay.
go over, I promise. Well,
Okay.
because that's not there's a lot more as far as knowing when you might need to bring in help. I just wanted to make the point that if friends or family are telling you that you need help because they see or hear you probably should listen to them. If a loved one cannot leave the home, and this may be there 24/7, you should probably bring somebody in so you're not tied down. If you're thinking about assisted living, it's a good time to bring in help in the home, because you can get the person used to having somebody else care for them, and you can maybe even delay the timing for a move or prevent it altogether, because you can get good care at home. And people with, it's also better to start earlier. Everybody waits too long and waits till crisis or something happens, and then you really don't have as much choice. And particularly for somebody with dementia, having somebody earlier helps, because if you wait till the person has much more advanced dementia, it can be really frightening for them to have this stranger come in.
Okay. How do you find the care you may need if you're looking to age in place?
Well, there's two main options, using an agency or hiring privately. And there's no perfect solution, no better solution. It really is, everybody's individual choice. I'll start with hiring privately. It does require that the family caregiver have the capacity to hire, train, and manage care, write job descriptions, set things up for success. When I was hiring, I just cast the widest net I could possibly cast. I emailed everybody I knew. I knew that they wouldn't be candidates, but I don't know who they know. And it could be family members or neighbors or friends, and I was always able to get referrals that way. I posted on Marketplace. I posted on Vail Moms. I posted ads. I just cast, you can post with a college where students are maybe studying to become a nurse. I did all the background checks, which is another topic, but you should definitely do that. And I also set up an employer identification number, because you need to be the employer. It's a misnomer that you can just give an in-home caregiver a 1099. They are considered a household employee, and they don't have the freedom to make their own hours and choose their own tasks, and so the IRS views them as an employee, so you need to pay employment tax. So I used paychecks to handle that, to avoid it. And many people say agencies are just too expensive, but privately, anywhere from $20 to $48 an hour. With an agency, yes, it can get up to $50 per hour, but if, all the things that I was describing that I did, if that sounds like a lot, then you can better appreciate having an agency do it and why you would pay them for all that work. Another option is to have a care manager. I am a care manager, an aging life care professional. I can help families get set up, write job descriptions, help with what they need to do to find a caregiver and get things set up for their success. And then lastly, I think it's a good option to use both, have private, but also have an agency on board. So that way, they know your loved one, have them work on a regular basis. It just could be their minimum requirements, but that they are in the mix. And then if something happens, if there's an emergency or your caregivers are sick, they can come in and and step in.
Thanks, Wendy. I have one more question. Are there any key tips you have if someone is thinking about home modifications?
So I think the big topic here in this valley is stairs. It's hard to find a home without stairs in Eagle County. So being able to set up a living situation where it's on main floor or one floor living, which can be converting a room into a bedroom. If there are stairs that you need to go up, getting a stair lift if you can't do stairs. Minimizing risk is the big thing, making space to move around easily, arrange the furniture in a way that you won't be hitting things, and you removing throw rugs. At night, it drives me crazy when people feel that they have to, no matter what their circumstances, get up and make their way to the bathroom on their own at night. That is so often when falls happen. And there is something called a 3-in-1 commode where you can have next to your bed. You can also use that same commode over the toilet because raising your toilet level is another modification that you'll find. Handrails, there's so many pieces of equipment, shower benches, you name it, that are out there that can help somebody live safely in their home.
Thank you, Wendy. Jen, would you mind explaining senior living communities? What is independent, assisted, memory, and skilled nursing?
Sure. Well, you can partly do this too. So, so I think the challenging part with looking at different senior living is it changes. So I'm going to tell you in general what places are, but know that it's not like a black line that independent living switches to assisted at this, and then assisted switches memory care at this. Every building's different, and every community's different. So how it's set up at Castle Peak may be different than how it's set up somewhere in Denver or in Grand Junction. So the first level of care is 55 plus. That's just an age-restricted apartment complex or community where there's no care, there's no housekeeping, there's no meals. You just know that you're not gonna have some teenage kids screaming at 2 a.m. 55 plus. For a lot of people, that's great. You get to live with people that are in the same stage of life as you, and it's easy to make friends, and everyone around you is kind of the same as you. Independent living would be one step up from that. That's a little more support. They'll have housekeeping on staff. They'll have meals, which often is a way to interact with people because you all go to the same meals. They'll have some activities. Sometimes they have transportation. But if you need care, you don't go to independent living. It's independent. Most people are still driving at that point in most independent livings. So that's independent. And this is when it starts getting blurry. In independent, sometimes they have in-house home care. So you can stay in independent if you're already there and get a little bit of help. So that's independent, grayish, going towards assisted. Next level up would be assisted living. Assisted living helps with activities of daily living, bathing, grooming, dressing, medications, transportation. But their goal is to keep you as independent as possible. They're not going to help you if you don't need it. They're going to try to figure out a way for you to stay independent and not help you. I mean, selfishly, they want you to live there as long as you can. So they want you to be independent. Again, it's a great way to meet people who are in the same stage as you are. And many times, if you're in assisted, you end up passing away in assisted. You don't need to go to skilled nursing because at that point, you have the support you need. Next level up is, again, blurry, would be memory care. Memory care is higher staffed. They're prepared to help with more hands-on care. For a lot of memory care settings, this means it's secure because they don't want you to wander out of the building, but not always. There's all different types of memory cares. There's memory care that people are very high functioning still. They're going out on gatherings, they're doing events. They just happen to get really confused sometimes. And then there's memory cares that are almost a nursing level care where this is really high needs. And part of the challenge for us in Care Patrol and anyone in my position is matching you to the one that's right for your care needs now and in the future. The last level of care is skilled nursing. Skilled nursing is complicated too. So you can go to skilled nursing for rehab, where your insurance pays, you get better, and then you go home. Or you can go to skilled nursing for long-term care. If you have the funds and you can do assisted living. Usually assisted living is cheaper. But at skilled nursing, you need nursing care. You need IV medications. You're not able to participate in the transfer at all. Like you can't even put your feet down. Or sometimes if you have like advanced medical needs, like seizures, then you'll be in skilled nursing. But for many places, much of your care can be done in assisted living or memory care.
So Jen, when does it make sense to move into a senior living community? And what would be some red flags that might promote you to do that?
I think when you move it's going to be different for everyone. It depends where you're at. For some people, they don't have the emotional, spiritual support. They don't have a social engagement. They're not active in their community. They're not eating well. They could be independent, but what we say is they're just merely surviving. They're not thriving. That could be a good time to move. Even if you're independent, if you're just barely making it through every day and you're not enjoying your life, it could be time to move to a 55 plus or an independent living, right? Not because you need to, but because your life's going to be better if you have some of that support around you. The red flags happen when you're not getting the sufficient care. Maybe your support system isn't there. Maybe you don't have family support and you haven't hired a caregiver, and now you have frequent hospitalizations and you're not taking your meds and you're missing doctor's appointments. These are some of the red flags we look for. And these are the ones we tell families to look for. If you see your mom's been in the hospital 5 times in 1 year, red flag. Even though she's like, I'm fine to go home. You're like, maybe not. What else was in that question?
How do the communities differ, the different communities? It's hard to explain, I'm sure.
Yeah, so I always if I had a board, I would draw this line, and then I would draw marks all over it, because every building's different. There's memory cares that offer super high acuity, and there's memory cares that don't do much. And there's independent livings that they don't have anything, and there's independent livings that have home care and do a bunch of care. So the big point is finding a place where you're going to feel comfortable. Are you near your support system? I mean, in Eagle County, you have one option. So, if you're trying to stay in Eagle County, this is where you go. This is where your support is. But for some people, they have family in Chicago. They have a daughter in Florida. Where's my Florida guy? Somebody wants to move to Florida, right? Then we look in Florida. That's where you want to go. So being in the place is really dependent on your specific situation. There's my Florida guy. In the situation that you're looking, that's specific for you. People are like, what's your favorite assisted living? I don't have one, because it depends on what your situation is. Did that answer it?
Yeah. Thank you. Thanks, Jen. Shelley, could you mind elaborating a little bit on what is rehab versus long-term care? And what does medical insurance cover and not cover?
Yeah, thank you. So let's start with rehab. So rehab is a place where you come for a short time. Typically, people land in the hospital for some reason. Maybe it's an elective surgery. Maybe you fell skiing. Maybe you have pneumonia. Whatever the reason, you've landed in the hospital and you've had a 3-night qualifying stay through Medicare. And then you want to go back home, but you are not ready or not strong enough for whatever reason. Maybe you have those stairs that Wendy was talking about. And you need to go someplace just for a short time. That's rehab. So you would come to a rehab and typically when you're there, you get some pretty intense therapy, PT, OT, speech. And really the main goal is to make you strong and make you back to your level of care where you can go back home. Or better. Yeah, a lot of times it's better. And usually the typical stay is between 2 to 4 weeks. It depends. Some people are there for 5 days, and some people are there for 3 months. So it just kind of depends on what happened to you and how many injuries you have. But that's rehab. And they have 24-hour nursing care, aides there around the clock. So you get all of your care taken care of. Long-term care is more of a permanent. This is now going to become where you live. This is going to become home. And typically long-term care is in skilled nursing. It can be in assisted living, but long-term care is, so at Castle Peak, the average length of stay there is about 2.5 years. And so this becomes the place where they live, and they decorate their apartments, and it really it becomes home. And you get all the same services. You get 24-hour nursing, 24-hour aides, meals, activities. It's kind of, in a skilled nursing, it's kind of all inclusive in a way. There are some extra charges, but that's what long-term care is.
Okay, thank you. What are the criteria for memory care versus assisted living?
Well,
That's a gray one.
kind of like Jen said, that's gray. You know, there can be assisted livings that have memory care built right within them. And then there can be skilled nursings that have memory care built within them. And the level of that care really depends on the community. So that is not going to be like a black and white answer. I think the best answer is you have to tour the communities and see which one fits you and which culture you like and what kind of care you want. So assisted living typically has aides there. They don't have nurses 24/7 typically. They have a nurse on call that will always respond, but they don't always have their building staffed with nurses. Whereas skilled nursing is mandated and regulated. They have to have nurses there and they have to have a provider on call. So you'll have access to a physician of some sort. So that's kind of the difference between that. But I would really just recommend touring and seeing which one fits you.
And at Castle Peak, don't you guys evaluate people individually to recommend
Yes,
where they go?
So typically, I didn't want to get too much about specifically
Okay,
Castle
yeah,
Peak,
sorry.
but I absolutely can. I'm happy to share. So yeah, and I think every community is fairly similar, no matter where you go, is that you'll take a tour. You'll kind of figure out if you want to move forward, and then typically they'll have a nurse meet with you if it's going to be like a permanent situation. They'll meet with you, they'll do an assessment, they'll create a care plan, and then you'll decide, like, yep, this is a good fit for me, this is what I want to do. Now, if you're coming in on rehab, typically the hospital does the referral, so that's a little different. But if you're coming in to live, to move in permanently, then an assessment would be done, yes.
Thank you.
And just one thing, in the independent and 55 plus, they don't do that assessment. They're actually not allowed to. So you just do the assessment for assisted living, memory care, and skilled nursing.
Thank you. And what is specialized care provided in memory care? So what's different about memory care? What happens there?
Yeah, I think we've touched on it a little, but typically that is a secured area. So a lot of times, what I mean by that is the doors will be locked. Now that sounds really scary, and I don't mean it like that. It doesn't feel like that at all. Really, that is just for the safety. So typically people have some sort of a elopement risk, a wandering risk, where they may go out the door and not necessarily know how to get back. And so we want to keep people safe, but I promise you most of them feel very cozy and very much like a home. And so you wouldn't even know that it's locked necessarily, but that's a huge thing. But in regards to the programming, did you want to say something? Sorry.
Just on a secured unit, just because someone's in a secured unit doesn't mean they can't leave. So the family member can come and check them out and take them to a baseball game or whatever, and then check them back in. It's just for when they're there to make sure they don't wander out and they're not with anyone.
Totally agree. So onto the social or the programming part of it, yeah, most of the time they have an activity staff on board that will do very specialized programming in regards to someone who have cognitive issues. Oftentimes there's a lot of, they don't stay in the area, they take staff and they could go to many different things. It's just that there's supervision. All of the staff that work in memory care, and this is, Colorado regulated, you have to have the very minimum. Most people have way more than this, but the very minimum is you have to have 4 hours of dementia care training. Now, most sites have a whole lot more than that, but I'm just giving you the bare minimum. And it could be things like just people with cognitive deficits sometimes have like like even just a simple game of bingo, you think that that's a super easy game, but actually there's a lot of thinking to bingo. First you have to take in the information, and then you have to find the B on the board, and then you have to go down and find the 9. And there's just a lot of sequencing, and so the programming up in that area is just different. So instead of maybe having all that sequencing, it might be like picture bingo, like find the flower, find the dog, find, whatever it is. And so it's just a little more easier to track. And so all of that programming is just a little bit different.
I just wanted to say that when you talk about hiring privately, you can also combine having private caregivers in independent living and in assisted living. And so it's difficult in assisted living. There's everybody wants help at 8 in the morning or something, there's, so if somebody wants, I want help with a nice long shower, like my mother, then we hired somebody to come in when she was in assisted living to do that. So, and a care manager like myself can also help assess somebody to know, because you say they can't, they don't assess for assisted living or independent living, but you can hire somebody who can.
Thank you. One last question for Shelley. How far ahead should families start inquiring about placement if they're
Well,
thinking about it?
I think the sooner the better. Just like these
How long's
ladies.
the wait list, or does that vary again?
That'll vary, I think, on where you go. But I personally recommend everybody go to assisted livings or skilled nursing or any facility, or talk to Wendy, anybody. Learn about aging. And all of you, I'm so happy you're here, because clearly you're here to learn, and that's great. So I think the sooner the better. Take tours, build relationships. I don't think you can do it too soon. I really don't.
And I think a lot of people, you can now. You're able to walk, you're able to think through things, you have support. Look now when you can. You don't want to wait till you fall and your hip hurts and now look. Now it's hard to look. Now you're struggling and you have a time constraint. So look while you can, have a plan of what you like. If you never end up there and you end up staying home, great. But to be prepared, it'll help you sleep at night, and it'll help your family sleep at night knowing you have a plan.
Don't wait for the crisis.
Absolutely, yeah. Don't wait for the crisis. That's good advice. So you guys, we will open it up to questions. I just want to make sure that, we talked about these questions, and, everyone is concerned about cost. That isn't what this talk is about, because that could take days to talk about, programs. And so we're not going to address the cost for long-term care. So we'll go ahead with questions, and we'll ask you, if you don't mind, if you have questions, wonderful. That's what the panel's here for. But try to keep your questions broad, so it's not, specific to your own situation. Maybe if you have a specific question afterwards, we can track these guys down. Does that
I
sound
was
okay?
going to say, come afterwards.
Yeah, Jen wants to
don't
talk
get
to you
your question.
afterwards.
Oh, I always want
They all do. Okay.
You just let them know we have this so that it catches the recording. Debbie's going to bring a mic around.
Oh, great. Yeah. Okay. So does any questions for anyone here?
I've got an observation.
Okay, Dave, wait a minute. We're bringing a microphone over there to you. You do, Dave. You're on TV.
Just for the
It's for recording purposes.
Now I'll blow your eardrums out.
Okay.
My observation is, I called around before I put my wife into a memory care unit, and I would say that put your name on the list. You can always turn them down, and your name will go from wherever you're at when you get the phone call, hey, we got room for you, to put you at the bottom of the list, because you may not be ready when they call you. But you have saved that spot in that process. I learned that
That's great advice.
took me a while. Thank you.
Thank you, Dave. Any other questions? Debbie's coming around.
My question is, what advice do you have when dealing with a senior who's absolutely convinced that they don't want to change anything? They don't want to go anywhere, and they don't want anybody in their house, and don't quite know what to do with that?
I'll take that one.
Yeah, we all take it.
So, look, everybody wants to stay at home. Everybody wants to stay at home. They hope one day they just don't wake up in bed. That's everyone's goal, right? And you can't fault anyone for that, but you need them to be safe. So, I tell people to, of course, try home care first and explain to them, like, you have to let the home care in. You have to let them care. Or we're going to have to try something else. Sometimes they don't let them in. It happens. And then say, can we go look at places? Maybe they won't go. Then you should go. You should have a plan. And you should be like, okay, Mom, if something happens, this is what we're going to do. And then you have to follow through with it. So I think having that plan, we call it a care contract, saying like, this is a care contract. You have to let the caregiver in. Okay, you didn't follow through. Okay, care contract. We're going to have you go look at some buildings just in case. I want to see what you like. And when I tour with people, if they're in the stage where they can't voice their opinion, I watch how they respond. So if your mom walks in, she's like, I hate them all. But she walks into a building and you see her like look around and you see her like looking at the flowers, trying to talk to someone. That's probably the one she likes. She won't tell you, but maybe that's the one that if something happens, my grandma lived in Silt, if some of you might know my grandma, and she was like, I'm not moving ever. And she fell down the stairs and she hurt her shoulder. And I was so excited. And my parents were like, why are you excited? I'm like, it's not a hip. I was like, it was a shoulder. She can move with the shoulder. So it was just enough to move her to a place that she had gone to that she didn't remember, that she moved in and she lived there for 7 years and loved it. She wouldn't leave. I would come to offer to take her to lunch and she wouldn't go. She's like, they have great food here. Let's just stay here. So I think preparing those steps and having kind of a contract with her, and at the least knowing that you tried so that you can sleep well at night and you have a plan.
I was just going to say that we all know how well family members, listen to other family members, telling them what to know. They don't. So Jen or myself, having another person as a third party, because it is a process of, and so trying to have somebody who can build some trust, and if there's other family involved, getting them involved so that there's a plan that everybody buys into and supports, so everybody's delivering the same message to mom or dad and having that contract. I think particularly, particularly let's say somebody has some cognitive issues and we are going to allow them to make the best decision about their care. It's kind of, I kind of think about it as a teenager, when they say, I don't need a babysitter or whatever, and then they throw a fit because the parents say, yes, you do, and they're like, I hate you. But somebody has to be the adult.
Teenager.
Yes. Somebody has to be the adult.
The other option might be, I agree with both these gals, but a lot of times people will listen to their physician. So maybe make an appointment and prep the physician before you get there. Like, hey, this is what I'm seeing at home. They're gonna tell you everything's great. But then sort of have the physician help you get on that page. Kind of your partner's in this. And so sometimes that helps as well. And then I just had a random story. So sometimes it's not even people with cognitive issues. Maybe it's just like I had this bachelor that lived at home, and he just really was declining, but he was totally able to make his own decisions. But his brother was the one taking care of him. Well, they were both in their 90s, and anyways, he came into our assisted living, and he was so mad that he had to move there, but he did it. And he'd come to my office every day, and he'd be like, "I'm mad at you guys. I don't want to live here. And I said, I know. And then eventually, every day at lunch, he would come and tell me that. And then one day, about a month later, he comes to me all grumpy with a little tiny butterfinger. And he said, I'm still mad at you. But I love it here. It was the best decision ever. You guys are so nice. And I was like, oh, we finally won him over. So it takes a while to adjust, even when they don't want to come. Sometimes they still fall in love with the building and the friends that they've made. So
I wanted to reiterate your point about your physician, including your physician. I think a lot of people go to their physician and they tell them everything's fine. And there's a new, it's value-based care. Your physician should be going through a series of questions, asking about your nutrition, asking about your transportation, asking about your social engagement. They should be. Every physician should be having those. Be honest, so the physician has a good picture of how you're doing. And if you're a caregiver or you're the child of someone that's needing support, consider going to the physician visits with them so you can share your concerns, you can share the little tidbits that maybe they don't know. We had a lady in Golden who kept driving the wrong way down a one-way. She was fine otherwise, she just couldn't figure out the one-way drive. And finally her daughter had to go to the doctor with her, like, hi, can we talk about driving? Because otherwise the doctor wouldn't have known. So you have to make sure to share those things with the primary care physicians.
I think there was another question.
Yeah, my question is, I was born in 1948, so I'm kind of the beginning of the baby boomers, and we are such a big group that, do you foresee a problem that there's not going to be space for us? And if we want to get in, let's say, okay, I'm thinking I may need assisted living at some point, but I don't know when. But I want to get into independent living, so when I need it, I can get in there. And then, what's going to happen where are they going to put us all? If we need it. Oh yeah, we could go on a cruise for a year.
They are building more, definitely on the Front Range, and Shelley and I were just talking how I'm trying to convince some buildings to build up here. Wish me luck. But, I do think that's a concern, and that's one of the reasons why, if you can age in place safely, you should try. But the idea of a wait list is a real concern. I mean, the buildings are getting full, and unfortunately, as much as I love when clients call me and they're just preparing for the future, I'd say 80% of my clients are calling me in a crisis, and we get 100 calls a month. That's 100 crises a month. And so people aren't preparing. And then if you're that call, you have to go where there's a bed. You have to go where it's open. You might have to try to pick a place in a couple days. So yeah, like to your point, if there's a place you really like, get your name on the list and, have a plan B.
Your name on the list doesn't mean you have to go when they call you.
No, like he was saying, they can call you and you can say, I'm not ready, and they just call the next person. You just stay in order.
But you stay on that.
Yeah, oh, never mind. Everyone's different.
You have to.
That's
So
how it-
Shelley might have some more things to
Yes.
add, but I just
So-
want to throw in a contrary opinion before, because I can be like in between. So I do have a bias that there's a societal pressure that we all need to belong eventually in assisted living or skilled nursing. And I feel like, because there's this fear-based, well, what if? What if? I'm not a fan of fear-based living. I'm a fan of gathering information. Information is king, knowing what your options are. But the idea that even that you can get better care in assisted living than you can, is not necessarily, oh, that's the answer, I'm going to go to. There's a set of problems everywhere. There's no perfect solution. And so, I'm pushing back a little bit at this idea that, well, we have to short circuit our life and make this move we don't really want to make, so that if, then I'm going to be on this list. Now, if you want to do that, and it's, that's what quality of life looks like, and you really like the place, then great. but I just want to push back a little bit on that.
Yeah, don't move if you don't have to.
I agree with you. Yeah, I agree. Like you can totally age at home if you can, if you have the resources to do it and you can find the support. That's amazing. I think that's great. So I don't remember what else I was going to say. You got me sidetracked.
No, I'm sorry. I know. No, I think it was about, are there going to be enough facilities and space?
I think it was about the wait list. Somebody had a question about the wait list. I think you need to talk to the facility, whatever place that you tour and that you like, ask them how they run their wait list. That's how my building runs our wait list, but not all buildings run it that way. So I think you should just ask that question when you tour and before you put your name on it, right? You got to have the information.
Also check, like some wait lists, to put your name on the wait list is a nominal fee. Some it's considerable. So that's something else to factor in. Any questions? Oh, here you go.
I've been dealing with this for over 5 years. Information is your friend. The more information that you can gather and disseminate, the better off you're going to be. When I first hit the ground running, it was not good. It took me a lot of late nights, reading a lot of material, watching a lot of videos on YouTube, because the information's out there, but nobody's going to hand you a list and say, well, you need to do this, this, and this. It's up to you as the individual for your loved one to be as educated and informed as you can be.
And one point on that, be careful if you put your name online. A lot of places, it'll look like you're asking for information on a community. You've actually just put yourself on like a mailing list and you'll get like 30 phone calls in the morning. So just be really careful when you're online putting your information in anywhere.
Stay off of Dr. Google too.
Thank you. I know we're not talking about costs and that, but I did have a question. Are there any instances where Medicare helps with long-term care expenses besides the 3-day hospital stay for a qualifying stay?
I'm working on it. So there is a program called the Medicare Guide Program, where if you have Medicare A and B, and you have a dementia diagnosis or dementia symptoms, that you can get a case manager who will, it's virtual, who will meet with you, go over medication reviews, will do help with caregiver support, caregiving suggestions, and it will cover $2,500 per year. It renews on July 1st towards care. I say I'm working on it because right now I'm the only one that can sign everybody up. So I need to get some help. But we're going to figure out how to pull this into Eagle County to get this program here.
So how would we find updates on that?
If you want to sign up, I have like a newsletter and I can update you there.
Anyone else? Any other questions?
If there's no more questions.
Thank you, Dan.
Okay, there's a question.
Also on the cost front, but staying generic, does Medicare cover any in-home care?
Just that program, just that $2,500. There is some ways for some medical insurance to cover some home care. It has to be tied to an inpatient stay. And then when discharged, sometimes I can get some covered that way. And I've worked with Vail Health to play with that, but it's only like certain policies and they have to have cross certain boxes and it's rare.
Staying on that same topic, does Medicare cover any rehab?
Yes. Yes. So if you have a qualifying stay at the hospital, the 3 nights, then it'll pay for that inpatient rehab at a skilled area, a skilled nursing facility. And so it covers the first 20 days. And then day 21 to 100, there's a copay that you have to pay. Yeah.
And are there rehab hospitals in Eagle County, rehab facilities?
Yes. Castle Peak Senior Life in Eagle. Yeah. The only one. Yeah. Oh, there's one in Coverdale.
Thanks. I have another question, please. For the different levels of care in the senior living, are there different staffing levels associated with each of those?
Mm-hmm.
Could you tell me a little more about that?
Yeah, so assisted living typically has a different staffing level than the skilled nursing. I think that's your question, right?
Yeah, kind of wanted the numbers too, but it's 10 to 1.
Yeah, that's going to vary depending on the site.
But at Castle Peak.
Sure, I can answer that one. Yeah,
Thank you.
very specific.
Thank you.
So at Castle Peak, we typically have, let's just do aides, for example. In the assisted living, we have 2 aides, and there's 20 people that live there. Now, Castle Peak does not, you kind of heard today that the levels of care in assisted living very much vary from community to community. Ours does not have the full helping you with lifting and those types of things. We're not that level of care. In our skilled nursing, our aides are typically in the long-term care area or rehab. It's typically 1 to 10 for aides for patients, but then we also have nurses on top of that. So maybe a better way to say that, it depends on disciplines. My head goes to disciplines. There's CNAs, there's nurses, there's LPNs, those kinds of things. So on the first floor, let's just say we have 21 patients and we have 4 clinical staff. That doesn't include any of the other staff. It's just 4 clinical staff. We also have nurse managers and DONs and those kinds of things, but hopefully that helps. But it gets complicated. Yeah.
Wendy, any other questions?
Yeah. Okay, I'd rather have them ask. Well, it's for recording purposes.
So, sounds like most of this stuff is talking about the individual. What if you want to go to assisted living or long-term care as a couple?
So there's, usually in assisted living, you pay the rent and the care charges. So if there's 2 people that moved into the room, you just pay 1 rent. And then you pay care charge for person A and care charge per person B. If person B has no care charges, then you don't pay care charges for them. Sometimes there's a second person fee that covers like the extra meals and if there's more housekeeping. But again, like every building's different. In Denver, we're up to like the Front Range, I should say, they're up to like 600 different buildings. I have a team. There's no way I can remember all of those. But each building has a different way they treat that scenario. Do you want to say how you do it here?
Sure. Do you want to specifically know how we do it here? Okay. So in assisted living, you can have an apartment. 2 people can live in there, no problem. You do pay a second person occupancy fee on top of your rent, and that's to cover, just like she said, the extra meals and the housekeeping and different things. In skilled nursing, we have private rooms, so that's very much regulated by the government. So it's only licensed for 1 person in 1 room. I don't have double rooms in the nursing or in the skilled nursing area. So.
The other thing that sometimes I have clients happen is maybe 1 person's independent and 1 person needs memory care. There are buildings, there's communities that have all different levels of care, and that could be an option where the person B lives in memory care and person A lives in independent, which is nice because it makes visiting and interacting, but then you also can not have to worry about being a caregiver at night. So that's another option people do.
Yeah, and it just reminds me with some people that I've worked with, one spouse is the caregiver, and they think, well, if I go to assisted living, it'll be easier. And not necessarily, because you are still that person for your spouse.
Oh, like if you stay together.
Yes.
Yeah, it's hard to stop being the caregiver, right? Like that, it's definitely a conscious.
And it's not,
hard.
yeah, and it's, you don't, people at your beck and call necessarily, so you're the one that they're going to say, I need this now. And so.
And it's simple things. It's like, hey, can you pick up my newspaper? Hey, I need a Kleenex. Hey, and it's all these caregiving things. But you're right there. So then they just ask you, and it's blurred. It's hard, yeah. But just know that the staff is there to help if you let them. So, if you let them, yeah.
So my mom lives in Arizona, and we brought her up here to try living in Colorado for a month. But I live at 8,200 feet, and she can't tolerate the altitude. And she can't tolerate it in Eagle either. So we went to, I don't know if I'm allowed to talk about it, but Roaring Fork Senior Center in Glenwood. So that's another option for people if this is full. But it was fabulous. It's on the river, and she could tolerate the altitude because it's a lot lower there. It's about the elevation of Denver. And they do activities and meals and everything. So I'm just bringing it up because there are other options other than Castle.
I'll tell you a whole lot of options. There are options. Eagle County, and this isn't about Castle Peak, so this is just about services available to you guys, right? So around this area, so there's Castle Peak, but there's also Roaring Fork and Glenwood. That's an assisted living and a memory care. There's also Glenwood Springs Health Center, which is a skilled nursing area. They have down in Carbondale, they have Sopris Lodge, which is an assisted living and memory care. They also have Heritage Park over there, which is a skilled nursing area and a rehab. So there are other options. They're just not right here, but certainly. So thanks for bringing that up. Yes, altitude can be a big deal.
And Roaring Fork is an Ascent building. Ascent is a Denver-based company. They're local. I know Susie and Tom. And that's an example of they have a reputation. Like that building was owned by someone before, and this new company took over, and now I think it's full. Right? They provide really good care. So knowing the reputation and knowing this is a good place where it matches me, or this is something I don't need yet, but I might in the future. Take your time, look through your options, see what's out there, and have a plan. You might never go there, but have a plan.
And I think having been a family caregiver, I just want to encourage caregivers to be able to let go and get help, whatever it is, whether it's in-home, placing somebody into a facility. It's a hard thing to do, but you can get better care. We weren't trained for this. I did not have the skills. My mother had this one caregiver, Julie, and one time she was off, and I got my mom all ready for bed, and I did all the nighttime routine, and she looked at me and she goes, "You're no Julie." I mean, it's kind of arrogant to think that maybe I can give the best care just because I'm related, and I'm too much like my mother, so it was not. So anyway, I just it's keep everybody healthy, and it does help keep people independent longer. You're not making them dependent. If you don't get care, you're making them dependent on you.
Oh, that's good.
Thank you. I just came up with that. You can. Well, I didn't know. I'd rather have questions from the audience if anybody has any other questions, but yes.
Does Eagle County have a gerontology specialist at all that can help us make these decisions outside of our family physicians?
I work with a lot of gerontological physicians, geriatricians. There's the word. So I work with a lot of geriatricians. a family practice doc that has a lot of this experience can also help in that scenario. But oftentimes, they don't know the whole picture because they just see you for that visit. So, and to ask them, I just did a YouTube video on this. They can do what's called a slum score. They can do a cognitive test that kind of helps determine, but really to figure out what kind of care you need the whole picture of how you're functioning day to day and where your struggles are, both physical struggles, emotional struggles, nutrition, mental health. So I think it's a lot to put on a geriatrician to know all that outside. Sometimes you need someone like Wendy who, there's a reason this whole specialty is coming about, right? There's a lot of things to factor in.
One more
There's our friend. I love this guy.
The wheels are turning, believe me.
You'll be on our next panel.
Okay. I don't know how many of you have long-term care insurance, but if you have a policy in place, you need to look at it and see if they offer a caregiver assessment. And usually what they'll do is they'll hire an independent, and the insurance company will pay for it to come visit and have your loved one evaluated. And that's just another observation other than the primary care physician. So,
And when you look at that long-term care policy, look to see if there's a window where you have to pay privately before it kicks in, because sometimes that's a great time to use home care.
yeah, the one I got had a 90-day exclusion. So that means I paid OPE, which is out of pocket, for 90 days before the insurance kicked in. And a piece of advice somebody gave me about long-term care insurance also is, if you have long-term care insurance and you make a claim, don't be surprised if they deny it. Turn right around, appeal it, and you'll get it taken care of. It took me a year to get my wife's long-term care to kick in, but you got to be a bulldog with these insurance companies.
I agree with that. You have to advocate for sure.
Yeah.
Because no one else is going to do it for you. You got to do it. Yep. And they all cover different things. So people, that's sort of a generic question. People will come to me and say, does my long-term care insurance cover this? I don't know. I don't know what policy you have. I don't know who. I can't answer that for you. You'll have to call them and see what they cover. Mm-hmm.
Anyone else? Any other questions? Okay. Okay, you guys, I think it's... Yes, afterwards, if you want to talk to any of these experts, they are available. So, no, we're not done.
Debbie and I. Okay. Thank you, guys. That's really the end of our presentation. So thanks, everybody, and Pat for facilitating. I'm going to let Debbie talk really briefly about something that is new for Caregiver Connections, just so you all are aware. And then, honestly, I'll just do that right now. Here's a teaser slide for our June event. We have some folks from the Alzheimer's Association coming to talk about some of the latest research, some early detection information, lifestyle factors, lots of just new upcoming information from them. We don't have the date yet. It will be here, same time, same place. For any of you that we have your email address, this is being recorded. Thank you so much to Eagle County Communications. They record this. We then send it out in a really nice little video so you can watch it anytime. We also have a huge library of all of our past talks from back to like 2013 that I can also include in that email. So just know that if you didn't capture all the information today and we have your email address, we will send that out for you to look back on anytime, but I'll give it to Debbie.
Hello, I'm Debbie with Caregiver Connections. I'm the Director of Care Services, and we provide resource and respite for caregivers and their loved ones in the Valley, in the Eagle Valley. And I just wanted to bring your attention really quick. There's some flyers on your table, and we are getting ready to open a new respite program here in Avon. We've got one already currently going down in Eagle at the Golden Eagle Senior Center. And so we're having an open house on the 16th, and we would love to have you come and join us and just see what it's like, see if you have any participants that would like to join us. It will be Tuesdays and Thursdays from 12 to 3. We serve a light lunch. We have games, activities, exercise, yoga, and we just have a lot of fun. And it gives your caregivers, it gives you a chance to get some things done and have some time for yourselves. So if you'd like to come and join us for the open house, we would love to see you. And we also have an activities buddy program that we just relaunched, and that's a one-on-one. So if your loved one doesn't really fit in with the social aspect of it and would rather have one-on-one activity buddy with them, we can also connect with you to get connected for them with an activity buddy. Thank you.
Thanks. Awesome. Thank you. Okay, I'm also going to mention one more thing because I think it's so important. People can't hear it enough. Caregiver Connections also runs something called the Medical Supply Closet. So I don't know, I think many people know of this, but if you are in need of a walker, crutches, raised toilet seat, shower bench, really anything you can think of that is adaptive to help people in the home, they have a program that they can loan that out to you for free. You can keep it as long as you need. You can return it when you're done with it. If you keep it forever, that's okay too. But it's very super important everybody knows about that. GetCaregiverConnections.org is the website. I think that's probably on your flyer as well. But they have a medical supply tab on that website and gives you more information. But super key to just know about that. And that's really for anyone of any age, right? So, yeah, thank you.
Okay.